You and your team work around the clock to reduce HAIs. Shouldn't your disinfectant? You employ the latest CDC guidelines, always incorporate the newest, fastest, and most effective environmental disinfectants. You've implemented better training and monitoring for the EVS staff, and you've even evaluated the enhanced UV light towers and hydrogen peroxide misters. Yet, you still worry about the risk associated with environmental contamination. Your concerns are supported by research. Studies by Dr. John Boyce proved what we all knew. Environmental surfaces frequently touched by healthcare workers are commonly contaminated in the rooms of patients colonized or infected with MRSA or VRE. Recent studies by Dr. Curtis Donsky have provided new insights on the role of hospital floors in contributing to the transmission of HAIs. His study titled, "Are Hospital Floors an Underappreciated Reservoir for Transmission of Healthcare-Associated Pathogens?" concludes, we found that floors in patient rooms were frequently contaminated with healthcare-associated pathogens and demonstrated the potential for indirect transfer of pathogens to hands from fomites placed on the floor. One of the implications of his findings was, studies are needed to examine the efficacy of current floor cleaning and disinfecting strategies in removing potential pathogens from floors. We know you always want to do more, because to you, HAIs are not just a rate. There are real people behind those numbers. We believed we could do more to solve this challenge. That's why we created CASPR. CASPR is a unique hands-free disinfecting technology that is installed in your HVAC duct. CASPR immediately goes to work for you, on its own, without any additional staff. CASPR's technology works 24/7 to reduce contamination whenever and wherever it occurs. With our facility-wide solution, patients are provided an added layer of protection from the moment they enter your facility until they are discharged. CASPR puts your environment to work for you. Our technology converts water and air into highly effective oxidizing molecules, which exit the air duct, and through normal convection, circulate throughout the targeted area, reducing dangerous pathogens on all surfaces, including floors and curtains. No training hospital staff, no operator required, and no more moving machines or delaying use of clinical areas. CASPR is completely safe to use in occupied spaces, and in recent studies, it's even reduced employee absenteeism. CASPR is proven effective against a broad spectrum of clinically relevant pathogens, like MRSA, VRE, CRE, Aspergillus niger, C. difficile, norovirus, rotavirus, N1H1, and more. To receive a complimentary baseline test of your hospital environment, call us today at 844-717-8819 or email us at info@casprgroup.com. That is CASPR group.com. To hear from current customers or learn more about the technology and process, continue watching. Meet Lori. Lori was an early adopter of the CASPR technology. She is the IP for a 532-bed award-winning hospital, and she is sharing her experience with CASPR. Lori was not compensated for her testimonial.
Saw somebody mention something about CASPR and it's in the air duct handling system. I'm like, oh, that's kind of what we've been looking for. It's something that would be no touch, no staff involved, no human error involved. So it's something that would be continuous. So there's a lot of attractive features to it. Staff, go in the room and do terminal cleaning. They do daily cleaning, but they're not in there all the time disinfecting that surface. When people come in and out, whether it's visitors, you cannot be there watching visitors if they wash their hands, if they bring in other organisms, if they cross-transmit any pathogens. So CASPR is kind of taking care of all of that, in addition to keeping that room safe all the time for everybody, and certainly decreasing illness as well for our staff members. Well, we're kind of early on, but right now everything looks really good for how well that we've done to reduce our pathogens, and whether it's bacteria or whether it's fungi. So we really have been very pleased with the reduction that we've seen to date, and then along with the reduction in staff illness.
The CASPR technology has the unique ability to give you a continuous added layer of protection across your entire facility, not only for patient rooms and ORs, but areas that are traditionally impractical or inaccessible, such as nurses' stations, hallways, and public areas. Areas well documented to contribute to the transmission of pathogens that lead to hospital-acquired infections. Every surface, even with the most diligent cleaning and disinfection protocols, is recontaminated frequently throughout the normal day. In 2018, the CDC funded a Prevention Epicenters program study titled A Prospective Study of Transmission of Multi-Drug Resistant Organisms, MDROs, between environmental sites and hospitalized patients. The study, authored by Dr. Luke Chen, Dr. Bill Rutala, and Dr. David Weber and others, found the standard hospital cleaning practice of performing a detailed room disinfection only at the end of a patient's stay, i.e. terminal cleaning, may be inadequate to prevent the acquisition of MDROs through the environment. Indeed, these results should compel us to develop new technologies and interventions to achieve safe, continuous environmental disinfection within the healthcare setting. CASPR's unique technology is the solution that researchers have been calling for, offering continuous treatment, facility-wide, every surface, every second, everywhere. Hear from another proponent of CASPR. Meet John LaRochelle.
The evolution of cleaning and disinfection, really up until the last 10 years, hadn't changed very much. So for many years, many of the experts in the industry really didn't focus on the environment as a potential threat for creating healthcare-associated infections. The floors, the surfaces, the water, the air were largely ignored as it related to this category. Only in the last 10 years have we really started to focus on these areas and be able to create technological advancements to really improve it. This really is the holy grail in terms of what we've been looking for in the industry for cleaning and disinfection, to fill the gap between what the housekeepers miss, what the nursing misses for cleaning and disinfection, and what these enhanced disinfection devices just can't hit.
With the constant introduction of pathogens into facilities, surfaces, and environments, we need a solution that works continuously without having to interrupt care or wait for the patient to be dismissed. We need a solution that works on all surfaces, 24 hours a day, 7 days a week, throughout the healthcare facility. A technology that can go to work as soon as the contamination occurs, before it can multiply and spread. A solution that has been demonstrated in laboratory testing and hospital trials to be effective in reducing clinically relevant pathogens. CASPR is your continuous solution. The actual CASPR device comes in two sizes, 9 inches and 14 inches, each designed to cover a defined range of square footage. It is easily and affordably installed into your existing HVAC. Our team of experts handle everything. They work with your HVAC plans to determine the number of units needed for the entire facility or specific areas targeted for treatment. The appropriate units are placed into the side of the air duct, near the area to be treated. This install is completely managed by CASPR. To give you an idea, a typical 25-bed unit generally needs 7 to 9 devices to provide an added layer of protection on all the surfaces of all the patient rooms, halls, nurses' stations, and public areas of that unit. Once activated, CASPR utilizes photocatalysis to convert the air and water molecules naturally found in normal HVAC humidity into highly effective oxidizing molecules, predominantly hydrogen peroxide. A completely organic process, CASPR uses cold plasma, which is a light source in reaction with a titanium dioxide-coated matrix, to create oxidizing molecules which then seek out molds, fungus, bacteria, and viruses, oxidizing and destroying them at the cellular level. That sounds pretty technical. How about an analogy?
The example I'd like to give is when you turn your shower on in the morning. Slowly but surely, that steam condenses on the walls and covers every surface of a bathroom, right? So imagine that's what's going on with CASPR, is that we have molecules that are in the air, circulating through natural convection, settling on the surfaces, and soon you have a coating of very, very effective oxidating molecules on all the surfaces.
These oxidizing molecules exit the duct and through natural convection settle on all the surfaces, including curtains and floors. The highly effective molecules are generated continuously at levels safe enough for occupied spaces and well below OSHA and other guidelines. CASPR is Wi-Fi enabled and provides constant tracking to ensure that it's always accurate and always on, protecting your facility, your patients, you, and your staff. The technology is virtually maintenance-free and comes with an annual environmental assessment that you can use to demonstrate your commitment to improving the environment of care. All of this sounds great, but what are the results?
Results of what we've done to date have been fairly consistent. We've been able to reduce the microburden and level of pathogens between 8 and 10-fold. Would you not want your facility to be 10 times cleaner if you could make that happen?
To get started, contact us for a free baseline environmental assessment and installation quote. Call us today at 844-717-8819 or email us at info@casprgroup.com. That is CASPR group.com.